Hello and welcome to my channel. This is Dr. Victoria Givens, your board-certified facial plastic surgeon and owner of Givens Facial Plastic Surgery in Austin, Texas. Today I am talking about the benefits of, and if you are an ideal candidate for, chin and jawline liposuction. So stay tuned to find out everything you need to know, and don't forget to hit that subscribe button and like below. Let's get going. All right, so here we go with the topic of the day, if chin and jawline liposuction is right for you. Over time, the facial tissues lose volume and move downward, creating a full neckline and poorly defined jawline. And the skin becomes less elastic, fat deposits appear, and the underlying musculature loses tone, creating a heavy, aged appearance of the neck. Now, chin and jawline liposuction is a permanent solution to fat reduction for long-term facial rejuvenation. It is a non-surgical procedure that uses a series of well-hidden incisions to reshape and slim the lower face and neckline by removing excess fat and tightening loose skin. I mean, can you believe it? A single procedure can redefine the jawline, reduce or eliminate a double chin, and remove diet and exercise-resistant fat for good in less than an hour. Sounds like an easy treatment choice, right? Well, to achieve satisfactory results, there are 3 things I look at to determine prior to deciding whether or not you are an ideal candidate for a chin and jawline liposuction procedure. Let's look at them. Number 1, physical features. When assessing your anatomy, you will generally fall into one of 3 types of candidates. Type 1, these patients present with minimal laxity of the skin, moderate jawline definition, strong chin position, and a small region of central fat below the chin. While age is not a factor in determining categorization, type 1 clients are often younger and have early signs of aging, and liposuction alone is generally the most beneficial for these clients. Type 2. This is the most common category. These patients present with moderate laxity of the skin, moderate jawline definition and chin position, and fat accumulation that extends widely across the undersurface of the chin and jawline. There may even be some extension downward along the surface of the neck as well. Liposuction plus or minus a chin implant may be necessary in these clients in addition to other skin tightening procedures. And finally, type 3. These patients have a heavy neck with significant skin laxity, excess fat accumulation, muscle banding, and a poorly defined chin, jawline, and neckline. Men typically fall into this category because of their thick skin and prominent hair follicles. Liposuction alone is generally not the only treatment that is offered, and more invasive techniques are often combined with liposuction for optimal results. Number 2, social attributes. Now, I can easily give a blanket statement saying the ideal candidate for a liposuction procedure is a non-smoking, realistic individual without medical conditions that impair healing. And while this is pretty self-explanatory, there are a few conditions to be aware of when determining if a patient is an ideal candidate for a liposuction procedure. Number 1, smoking is a no-no. Current use of tobacco and nicotine products, including but not limited to cigarettes, vaping, patches, and even gum, can result in extremely poor wound healing during the healing process. Number 2, medical conditions like collagen vascular diseases, certain autoimmune conditions, uncontrolled diabetes, and a prior history of radiation of the head and neck are also contraindicated due to poor wound healing and a higher risk of complications. And then 3, weight changes. Weight changes are a normal part of life, and while these fluctuations are not a contraindication to qualifying for a liposuction procedure, a relatively stable weight is preferable prior to proceeding with treatment. Number 3, mental awareness. Mental health and stability are huge factors in determining liposuction candidacy. It is important for me to understand why a patient is seeking a change in his or her physical appearance in order to determine if he or she qualifies for a procedure. Those with unrealistic expectations of surgery, those under pressure to have surgery by a relative or significant other, those who are struggling with their mental and emotional health, and those who believe a procedure will solve a failing aspect of their life do not qualify for this procedure. If this procedure does interest you, I encourage you to watch my other videos on why the face and neck ages, treatment options, and recovery. And as always, we know that personal transformation is one of life's most meaningful journeys. And Givens Facial Plastic Surgery offers a comprehensive, customized approach designed to reveal unrivaled yet natural aesthetic results for those who refuse to settle for anything less than the very best. Thank you for watching. You can find all of my office's contact information and social media platforms below this video on my channel. Don't forget to subscribe, and I'll see you soon.